Hello and good evening, everyone. I hope you have a wonderful day so far and you are ready to learn and find out a bit more. Once again, we do have an amazing guest with us tonight. As I mentioned yesterday, of course, we are continuing with talking about fertility preservation. And this time we have invited Dr. Clara Colomé from Eugin. She's the deputy medical director at Eugin Barcelona. So we have another doctor from Eugin. Thank you so much for joining us tonight. And how are you feeling, Dr. Colomé?
Hi, Caroline. Nice to be back with you. Hopefully, we'll lighten some information for the assistants today about fertility preservation.
Excellent. Happy to have you on board once again. This is your third, if I'm not wrong, webinar with my IVF. So thank you so much. It's always great to have you here for sure. And yes, we will discuss fertility preservation. But this time, actually, there will be some success stories. So we all love those stories with a happy ending. And of course, Dr. Clara will simply walk you through how it all works. So I'm really, really excited to see what she has prepared for us. And as always, we will start with her presentation on our topic. Afterwards, your favorite part, Q&A session will follow. So just remember to type the questions in the chat section and Dr. Clara will simply answer them for you one by one. Don't hesitate. Anything that's on your mind, don't hesitate, simply put it in, and I'm sure she'll be happy to help you out as much as she can. And of course, remember, it's being recorded. And yes, I guess we are all set. Yes, let's start with the presentation, okay? All right, here it is.
Okay, thanks, Caroline. So again, as we just said, we'll discuss success stories about fertility preservation. But first, we'll do a short introduction on the topic. Well, nowadays, you know that women are able of controlling their fertility and when to have children, and therefore you can decide to delay motherhood. Unfortunately, this might have an impact on your chances and the possibilities that you will eventually have of really having a child. And this is because it is well known that fertility declines with age. You can see in this graph that fertility declines with age. This is 35 to 39 years old and then 40. You can see there's a sharp decline starting at 35 and especially after 40. That means that the older you get, the more difficult it gets to conceive. But on the other hand, the chances of miscarriage due to genetic abnormalities, for example, increases with age because the remaining oocytes, the remaining eggs on the ovaries, have more alterations with advancing age. Therefore, the chances of really having a child at the end are much, much lower when you pass 40 years old. So, what are the options that we have? Besides the obvious option that would be to conceive between 18 and 30 years old, well, there's a possibility of vitrification. Oocyte vitrification allows us to stop the biological clock. In order to do that, and this is not the topic of this session today, but you have to know that you have to perform a medical treatment, an ovarian stimulation for a couple of weeks, and then we retrieve the eggs through a very short and simple procedure, and then we cryopreserve them. We vitrify them in our egg bank in order to keep them here with the same quality stable during following years. But again, the goal of this treatment is to use these eggs in the future. So how many do I need in order to have a child? Well, in this study, they analyzed the probability of having at least one live birth depending on age and the number of mature oocytes preserved. So each line is different age. So you can see here the brown line, when you're younger than 35 with 10 vitrified eggs, your chances not of getting pregnant but of having a child at home are around 70%, which is great. However, if you are 40, which is this other brown line, for example, your chances of having a child with 10 mature eggs are a bit less than 30%. So you can see the huge difference. So basically this means that the younger you are, the fewer oocytes that we will need in order to achieve a child. Therefore, the number of ideal oocytes that you have to preserve are linked to the age you have when you preserve and also to your life plan. I mean, how many children do you want to have? So basically, this is how the procedure works in general and what literature tells us. But what's our experience here at Eugin? I'm not sure if you're aware of that, but Eugin Clinic was one of the first clinics to establish a very complete vitrification program in 2011. Our fertility preservation program is called Time Freeze, and we've had around 1,500 patients who have preserved their fertility with us. So I'll show you a bit what are our results. So who are the profile of patients who come for fertility preservation? Well, almost all of them are single when they preserve their fertility. 93% are single. And how many oocytes do we obtain? Well, you can see here the evolution of the mean age of our patients that preserve their fertility since the beginning of our program in 2011 up until this last year. Okay, and we are quite proud of this. It has to continue declining, but as you can see, at first, since the general population knowledge about the subject, but also the gynecologists and the general doctors' knowledge about this topic was lower, the mean age for patients who came to preserve their fertility was higher, was around 40 years old. But with the more widespread information about this and the declining of fertility with age, and the fact that gynecologists and general doctors are more aware of the fact that they have to advise their patients to preserve their fertility or to ask them about their fertility options younger, we've seen the mean age decrease up to now we are around 37, and we'd like to keep it going a little bit lower. The fact that our patients are younger and younger, this is the red line is the one of the age of the patient, is also correlated with the results that we have when we do a pickup. So you can see here the blue columns are the mean number of oocytes that we obtain per cycle. So currently we are at almost 10 oocytes per cycle, which is, if you remember the graph I showed you about the chances of having a child at home, is quite a good number. The younger we are, the more oocytes we'll obtain per pickup. It is also true that some patients, in order to have a reasonable number of oocytes preserved for the future, they do more than one cycle. So the mean number of cycles per patient is 1.3 at this point. Okay, so that means that with only one pickup, most of our patients obtain a reasonable number of oocytes. So that's what most of our patients have done so far. But again, the goal of this treatment would be to eventually use these oocytes in the future. So we've asked ourselves, how is it going with those patients that come back to us? Well, first of all, remember I told you most patients who preserve their fertility were single. Well, when they come back, half of them already have a male partner. And those who do not have a male partner, around 45% are single, and therefore they use donor sperm, which is possible here in Barcelona, here in Spain. And around 5% have a female partner, which also means that they will need a sperm donor for the treatment. And what's the returning rate? That means how many of those patients who preserve their fertility have already come back to use these oocytes? Well, of around 1,500 patients, 123 have come to use them, and we've performed 130 transfers because some of them have already done more than one transfer. The mean age at the moment of the transfer was 41 years and a half, and the mean age at cryopreservation was 38.5, which means that around 3 years pass between the year where you preserve the oocytes and the year that patients decide to use them. And also that the group of patients who've started using those oocytes are the ones that vitrified later on. and the younger patients haven't used them yet. However, we think in the following years, this mean age at transfer and the mean age at cryopreservation will decline, because the mean age of our preserving patients has also declined since the beginning of the program, especially in the last 3 or 4 years. So this is a bit how things are described in the literature, what our real experience is, but I think it's interesting to see real stories. So I'm going to explain to you some real cases. Of course, we've modified some things and they are anonymous, but these are real things that happen to us every day. And we're lucky to help these patients out. So first patient is kind of one of the classical preservation patients that we had a few years back, because she came here in 2015. She was 38 years old, and she had a good ovarian reserve for her age. In fact, we did, as you might know, there are different ways to evaluate the ovarian reserve, and we use the antral follicle count with the ultrasound, or a blood test to check AMH levels. And this patient had a good ovarian reserve. She had, for example, an antral follicle count of 14, which is a good ovarian reserve. She did a stimulation cycle, and we were able to vitrify 8 mature eggs. A couple of years later, this patient found a male partner, and she decided to have a child. She was 40 years old. She tried naturally for a few months, because it's what we usually recommend, and she got pregnant and had a first baby, a baby boy actually. So far, she didn't use her vitrified eggs. However, she was planning on having a larger family. And a couple of years later, when her baby boy was 2 years old, she came back to us. She was already 42 years old, and she wasn't able to conceive naturally. And our advice at that point was to use the vitrified eggs. So we thought the 8 eggs that we had, 7 survived the thawing process, and we obtained 4 embryos. We transferred 2 embryos on day 3 of embryo development, and she got pregnant and had a second baby, another baby boy. And currently, she's under treatment to use her other 2 embryos and see if she can have even a third child. Okay. Then we have this other patient who came to us in 2015. She was 37 years old, and she had a very good ovarian reserve, and she managed to preserve 21 eggs. She came back to us 4 years later, actually, in 2019. She was 41 years old, but her ovarian markers were still very good. So since she wanted to have a large family, we decided together, we evaluated the different options that we had, and together we decided she wanted to try an artificial insemination. She didn't have a male partner at that point, and therefore she really hadn't tried to conceive naturally. So she wanted to give herself a chance. Everything was okay. There were no altered results on her previous exams, and therefore we went for the artificial insemination. However, after 2 cycles, unfortunately, it hadn't worked. And then we had a conversation to analyze what her options were at that point. And we decided to use the frozen eggs so that she didn't have to go through an IVF stimulation process again. Since she had 21 mature oocytes vitrified and she didn't have a male partner, we decided just to thaw part of these eggs. So in the future, if she met someone else and decided to have a child with a male partner, she had the option of using his sperm. So we thought 12 eggs, 11 survived, and 10 were fertilized. And eventually we had 5 good quality blastocysts that were apt for transfer. We transferred, of course, just 1 blastocyst, and she got pregnant and had a baby girl. And now she has 9 vitrified eggs and still 4 blastocysts in case she wants to increase her family. Just so you know, Actually, there's not a maximal age for receiving an embryo here in Spain, but the Spanish Fertility Society advises to accept it maximum up until 50 years old. So, of course, the younger you get pregnant, the better regarding pregnancy complications, even with the vitrified eggs. But she still has time if she wants to have a bigger family to think about it. This is a very different case. This patient came to us very young. We do not usually have women under 30 coming to preserve their fertility. However, this patient was lucky because her gynecologist during a checkup, did an analysis on her ovarian reserve. And she found out that she had a very low antral follicle count during a routine ultrasound. So she asked for an AMH level. It was also very low. So at that point, that patient already had a male partner, but she didn't want to conceive yet because she was very young and she still wanted to do other things before that. The mean age here in Spain for the first child, so that you get an idea, is 32. Okay, so she was quite young for our standards. And she decided to do a preservation. Her ovarian reserve was low, but she was very young, so we went for it. We had to do a double stimulation. That means that she underwent 2 stimulations and 2 pickups. And we managed to obtain 11 mature eggs that were preserved. And we kept them here. 4 years later, she was still very young, but she was in perimenopause already. And she came to us because at that point, she already wanted to have a child with her male partner. So we saw all the eggs that we had. All of them survived because they were very good quality. We inseminated the 11 eggs with her partner's sperm through the ICSI method, and we obtained 8 embryos, and all of them reached blastocyst stage. So we had 8 blastocysts preserved. We did an endometrial preparation. We did the embryo transfer of one of those blastocysts, and she got pregnant and has a baby boy. And she's still young and has 7 good quality blastocysts in order to increase her family in the future. And finally, I thought it was interesting also to see other situations. I mean, the talk was about success cases, but I think we have to see the global of the fertility treatment and the vitrification process. So this patient came to us in 2018 to preserve her fertility, and she was already 40 years old. Usually, at 40, we advise our patients to have a child at that point, to do an IVF or an artificial insemination, well, depending on the case. But fertility preservation is not the first option that we offer our patients at that point. But it is also true that, well, this patient didn't have a male partner, and she was very certain that she didn't want to conceive at that point. She had a very good ovarian reserve, considering her age, and therefore we went for it. She did 2 stimulation cycles, one where we obtained 6 mature eggs. But again, if you remember the graph I showed you about the number of eggs and the chances of having a healthy child at home, with 10 eggs at 40, your chances of having a child are 30%. So with 6 mature eggs, she thought, and we agreed, that maybe it was better to increase the number of oocytes to increase her chances in the future. So she did a second cycle, and eventually we obtained a total of 16 frozen eggs that we kept here. 1 year later, in 2019, this patient decided that she wanted to conceive, but still she didn't want to use her vitrified eggs. So she decided to go for an artificial insemination. Her ovarian reserve was still correct considering her age, and she did 6 artificial inseminations with donor sperm because she didn't have a partner. Unfortunately, it didn't work, which was something that you could expect at 42. And then together we decided to use the vitrified eggs because her chances with an IVF with her own eggs at 42 was much lower than with the eggs we had frozen at 40. So we thought all the oocytes that we had vitrified, 14, so we had 16, 14 survived, 10 were fertilized, and eventually we obtained 5 embryos. So if you compare this case to the one of the 28-year-old, you can see that there's a higher loss here. Fertilization rates and embryo development are lower, probably due to the ovarian quality linked to the age at the moment of vitrification. We did an embryo transfer of 2 embryos on day 3 of embryo development, and she got pregnant, which is great, but unfortunately, she had a first trimester miscarriage. The risk of miscarriage, if you remember, in the first image that I showed you, increases with age, especially when you turn 40. So, unfortunately, in this case, well, the patient still has 3 embryos. She's planning on doing another transfer in the following months. But, you know, the thing is that, again, preserved oocytes give us chances to have a child, but the older you get, the more chance, unfortunately, that it doesn't work when you preserved it. So to conclude, I wanted to tell you as a take-home message that fertility preservation is related to social changes, and it's steadily increasing its use for the last 10 years. And advanced age has a negative impact on oocyte quality and quantity. Therefore, once you've decided that you do not want to preserve to conceive at a certain point, the sooner, the earlier you vitrify your eggs, the better. Oocyte freezing gives us the freedom to put off the decision to become a mother, and this is a huge advantage that we have compared to women 30 years ago. But unfortunately, we have to be aware of the fact that it does not give us 100% warranty that we will be able to have a child. And this is also something that we have to consider. So basically, this is the main information I wanted to share with you. I hope it was clear and interesting enough. And again, as Caroline said at the beginning, if you have any question, I'll be happy to try to answer them now.
Excellent. Thank you so much indeed for providing all those details on fertility preservation, but also I definitely love the part with the examples, many different ones. So as we can see, that can happen to, I mean, you can be a younger woman, but also an older, and there are many different various endings to it as well. So thank you so much for bringing it.
Yeah, it's real life cases. So as you can see, anything can happen.
Exactly. So it's definitely interesting to see. So thank you so much for that. And now it is time for your questions. So go ahead, type those in, anything that's on your mind, just go ahead and do it. And let's start with the first question, okay, that we have from Kate. Let's have a look at it. So, okay, at what age you would not recommend freezing your eggs?
This is a very, very good question, Kate. Thank you. It is true that too young is not worth it if your ovarian reserve is good, because the chances of needing them in the future is very low. So I don't know, if you're 28 but your ovarian reserve is good, of course I wouldn't recommend you to preserve your fertility at that point. I would recommend you to check your fertility yearly, for example. And also, again, as I think unfortunately was the clear message of my topic today, is that the older you get, the more difficult it gets. Therefore, we usually recommend to preserve the fertility around between 35 to 38. That would be ideal, or between 33 to 38. And until 40, it's okay if you have a very good ovarian reserve. After 40 years old, we do not recommend it. We accept, however, to vitrify eggs in very, very specific and selected cases up until 42 years old, but only in cases where ovarian reserve is very good, so we expect to obtain a very good number of oocytes, and where the patient clearly is categoric on not wanting a pregnancy at that point. Hope that answers your question. Thank you, Kate.
Thank you so much for this answer, and of course for your question. And actually, Kate has added one more question. Okay, I
Sure.
think it's many times it can be quite confusing and challenging as well. So I'm 37 and have a partner. Is it better for me to freeze my eggs or freeze embryos?
This is a very, very interesting question. Okay, thank you again. So yes, 37 is an age where you have to start deciding something, that's for sure. And actually, my first question to my patients, because this question pops up every now and then, is, do you want to have children now or not? This would be the first question, because if you're really planning on having children, my first advice would be not to freeze eggs or embryos, but to have a child now, naturally, ideally, or through the help of fertility treatment. And that would be my first recommendation. If you are not planning on having a child right away, of course, fertility preservation is the best option. And regarding survival rates and pregnancy rate in the future, we have very good results with vitrified eggs. However, embryos survive better to the thawing process. So in a younger patient, the survival rate that we have now, at least in our center where we use vitrification for the freezing of the embryos, the survival rate of embryos to the thawing process is around 98%. The survival rate for eggs to the thawing process is between 85 to 90%. So embryos survive better to the thawing process. So from a biological point of view, maybe I would recommend you to freeze embryos. However, and I'm sorry for the long answer, but I think it's important to check details. It is also true that from a social point of view and from a personal point of view, your partner today may not be your partner in the future. I mean, I hope everything goes great for you too, but we've seen all situations. And once embryos are already created, if you change partner in the future, you won't be able to use them. So my advice would be, unless you plan a pregnancy in the following year, to preserve your eggs. Thanks for the question.
And thank you so much. Definitely interesting question. And well, there could be like lots of answers to it as well. Yes, depending on your situation. Definitely interesting. There are many ways to look at it. So thank you so much, okay, for that. Sarah has added one more question. So what is the process like and how long does it take?
I'm assuming, Sarah, thanks for the question, that you talk about the first part of the process, which is where you preserve your fertility. So usually it's a treatment that is started with the menstruation, and the whole process lasts about 2 weeks if we do just one cycle. So you do an ovarian stimulation with subcutaneous injection that you inject yourself on your belly, and you do that for 8 to 12 days usually. Then we trigger the ovulation, and 2 days later you come to the clinic for the pickup. And then that's it. So around 2 weeks, more or less.
Thank you so much for yet another interesting question, Sarah. And of course, Dr. Clara, thank you for the clarification to this one. And one more from Kate. So how many eggs do you recommend to freeze? And is one cycle of egg freezing enough?
Well, 2 different questions in one. Thank you, Kate. Very interesting again. The number of eggs that I recommend to freeze depends basically on your age at that point, and then again, your expectations. And for example, the type of family you want to have. So for example, if you have 37 years old, we usually recommend to obtain between 12 or 15 mature eggs, ideally. But this also depends a lot on, again, the type of family you want to have. I have patients who preserve 8 oocytes at 38 or 39, and they are absolutely positive that if it doesn't work, it doesn't work, and that it works, they only want to have one child. Therefore, this is a good result for them. I have other patients who want to have a large family with 3 children, and therefore, in that case, they will need more oocytes. And regarding the number of cycles needed to preserve these oocytes, it depends on your ovarian reserve. So as I told you, our patients do a mean number of 1.3 cycles. So that means that most of them just do one. But the older you get, the most likely will need more oocytes, and therefore you will need more cycles. Again, basically, if we need to say a number, I would say between 12 to 15 mature oocytes.
And wonderful. Again, thank you so much for yet another, as you mentioned, interesting question indeed. Okay, let's have a look. We have another question. Do you freeze immature oocytes?
Well, yes and no, actually. Thanks for the question. A very technical question, Derek. In fact, we freeze mature oocytes because these are the ones that in the future are the ones who are apt to be inseminated. But in some cases, we can do what we say in vitro maturation of oocytes before its preservation. So I'll try to not to be too technical, but oocytes, when during the ovarian cycle, they change their maturation stage. So it goes from immature or metaphase 1 to mature or metaphase 2. The ones that are metaphase 2 are the ones that are capable of being fertilized by a spermatozoa, and therefore are the ones that we need. If we inseminate a metaphase 1 or immature oocyte, it will never result in a living child or an embryo. So, however, we've seen that some of these metaphase 1 immature oocytes, if we leave them in an incubator for a determined number of times, might change stage to metaphase 2, to mature oocytes. And in those cases, what we call in vitro mature oocytes, those, yes, might be preserved in some cases, yes. Hope that answers your questions, Eric. Thank you.
Thank you indeed. Of course, if you have any follow-ups, go ahead and type this in. But of course, there is another question. Okay, let's have a look. So what preliminary examinations are obligatory to start artificial insemination?
Well, thanks, Sweta, for the questions. Of course, well, this changes a bit the topic, but yeah, sure. Basically, the main exams that all fertility gynecologists ask you for is especially a vaginal ultrasound. This is our, we use vaginal ultrasound every day for almost all patients in order to see the shape of the uterus, to see if there's any alteration in the uterus, and especially to check the ovaries and to check for cysts and other alterations, endometriosis, for example, but also to analyze the antral follicle count, which gives us a direct idea of your ovarian reserve. This is the main exam that we will ask you to do. Also, we might eventually, in order to complete this information, ask you to do a blood test to check your AMH or anti-Mullerian hormone levels. That also gives us an idea of your ovarian reserve with your age. And of course, your weight and your weight gives us also an idea of it and the regularity of your cycles. And then we will also ask you for basic exams to make sure you're in good health. So a full blood count, serologies to check for sexually transmitted diseases, for example. And depending on the case, we will also ask you to do an exam to check if your tubes are opened, which is usually a very difficult to say exam that's called hysterosalpingography, which is an exam where we introduce some liquid and then we check if the tubes are open, especially when you're doing artificial insemination with your partner or if you have any history of infertility. But basically for an artificial insemination, we need to know that you're in good health, that your ovarian reserve is okay, and that your tubes are open.
And again, thank you so much. A little bit off topic, but of course, still, thank you so much for your question indeed. And there's a thank you from Sveta as well right here for you. And actually, there is one more thank you from Kate. I definitely want to read it out to you. So thank you for answering the questions. I haven't really thought it through yet, it seems. Thanks so much. It was helpful. So
I'm sorry to put the pressure on you, Kate, but unfortunately, women, we are, when we are around that age, it's actually a bit of the pressure that we have. Luckily, now we have options, but definitely if you're around 37, 38 years old, this is something that we have to decide.
Definitely. Thank you so much. Okay. I mean, it's better to be aware, right? So thank you
Yeah.
so much indeed. So we will be slowly finishing. At least at this point, I do not see more questions. However, don't worry. If you would like to ask something else, or you would just need some additional information, you can simply get in touch with Dr. Clara and her team at Eugin, and I am definitely sure they will be happy to help you out with any questions that you might have. And so it seems that we will be finishing for tonight, but thank you everyone for joining us. Thank you for your questions. And I do believe it's been quite useful to you as well. And Dr. Clara, I've explained everything perfectly, and it's been very, very helpful. And before we finish, is there anything else you would like to add?
And no, thanks, Caroline, again for having me here today. I hope this was useful for you. Again, as you just said, if you have any other question regarding this treatment or other treatment, just contact Eugin Clinic, and myself or one of my colleagues will be glad to contact you to discuss them with you in particular. And again, lucky for us women, now we have different options, but we have to think about them and know them, and information is power. So that's for it. Thank you very much, Caroline.
Thank you so much indeed. And I'm very happy and proud that we are able to bring that to you all of those topics. I think that those are the topics that are still not discussed so much yet. And actually, one more thing, I was thinking, I would like to ask you one more additional question, because I know social freezing is not possible in every country. Do you see that, do you have patients from abroad that come to do it as well? Have you seen that?
Yes. We are an international clinic here in Barcelona, so most of our patients, of course, are local, but we have a lot of patients from abroad, and some of them come for fertility preservation because, lucky for us and unfortunately for other patients, fertility treatments are not necessarily allowed everywhere. So fertility preservation for social reasons is one of those. It is clearly accepted when we have a cancer diagnosis and we have a very important pathology in most countries, but again, in many, many countries, it is not possible to preserve fertility for social reasons. And I hope this is something that will change. But in the meantime, we'll be happy to help.
Excellent. Thank you so much for answering my additional question, indeed, because I think it's very, very important to know that even though in some countries it's not possible, don't worry. There are other options. You can, I mean, very soon, I think it will be more easy to travel as well. So thank you.
It's getting easier every day, hopefully.
Exactly. Fingers crossed it's going to happen very, very soon. And in the meantime, okay, one more thing is right here. One more question, sorry. So let me just show you, of course. Actually, does the quality of blastocysts deteriorate with time, and when?
Yes, thanks for this question, Biso. Actually, this is something that I haven't told you, but it is true that, again, when first of all, we usually preserve oocytes when we are talking about fertility preservation, but the quality of oocytes doesn't change with time, so that's a good thing. And the embryo quality as well. The blastocyst, which is a day 5 embryo, quality doesn't change with the advancing of time once it's frozen. So once oocytes or embryos are vitrified or preserved, their quality remains the same no matter the time passing. And that's one of the reasons why vitrification is so good and useful, because if you preserve your fertility at 37 and you want to use your oocytes at 45, if you were using your own eggs or your own embryos at 45 years old, your chances of having a child would be near zero. However, if you have your preserved oocytes or embryos, in the case of the question, preserved at 37, your chances of success at 45 will be the same as you would have had when you were 37, which is the goal of the treatment. So thanks again for this question and the opportunity to let me explain you that, Lisa.
Wonderful. Thank you so much indeed. And there's a thank you from other patients for, excuse me, right here. Thank you. Quite informative. Great to know as well. Thank you indeed for those comments. Thank you for all of your questions. And we will be finishing for tonight. I have put the link. You will be able to simply get in touch with Dr. Clara and her team using that option, of course. And as always, remember it has been recorded. So if you would like to take a look once again, you will be able to find it on our site, myivfanswers.com, and it will be available tomorrow. And if you go to our YouTube channel, again, it will be uploaded there. And as you know, there are over 300 IVF webinars available on our site as well. So plenty of topics. And actually, you can also have a look at previous webinars with Dr. Clara, because she has done some with us. And actually one of those was also on fertility preservation. So again, maybe that will be useful for you as well. Go ahead and check it. And well, that will be it for tonight. Thank you so much once again. It's been lovely to have you, Dr. Clara, and I hope we will have more events coming up with you very soon as well.
So do I, Caroline. Thank you again to all of you.
Thank you. Thank you so much. Have a lovely evening, everyone. And I hope to see you tomorrow. As you know, 8 p.m. UK time, we will be back. Thank you so much. Take care. Bye.